Hello, I'm Professor Dr. Ashish Davalbhakta and we are at Aesthetics Medispa and Advanced Aesthetics in Pune. Today's educational session on YouTube is going to be on fillers. A lot of you who would be planning to visit me would probably hear the word fillers. And nowadays in modern aesthetic medicine, fillers do form a very important component of facial rejuvenation. Let's talk about fillers and let me explain to you what fillers are. Fillers, synthetic fillers especially, are made of hyaluronic acid. Hyaluronic acid is a completely inert material that is almost 75% plus water. But the way the molecules are bonded together changes the characteristics of the fillers. And there are lots and lots of players in the market, companies which make fillers, and because of their ability to change the properties, the amount of hyaluronic acid in the product, they are able to increase the longevity. The longevity of the product depends on that, plus the characteristics to lift the tissue, to fill, and all of the properties that I'll be talking about. So these fillers are, as you can see here, made by some prominent brands. They come in boxes like these, and if you see that they are sterilized, pre-sterilized packets. So these are sealed packets, and these are 1 ml syringes with some needles which go along with it, and you can inject this filler in various planes of the face or tissues to achieve the results that you want. Now, why are fillers indicated? One of the most important reasons is that with aging comes a volume loss, and it's a very, very established concept that there is a volume deficiency or decrease as you age, and that changes or varies from part to part or zone to zone of your face. There are some areas where you lose more volume, there are some areas where you have more sag. So it's up to your clinician or aesthetic plastic surgeon to assess and decide which are the areas where you have had volume loss. And the volume loss is actually the first sign of aging that you see. Of course, next comes the loss of elasticity and the sag, but they come later on. The first thing that happens is a volume loss, and hence you will find that your esthetician or aesthetic plastic surgeon would probably be recommending fillers to fill those deficient areas. And once that deficiency is corrected, you will find that you will be looking fresh and youthful like you used to do before. So there are various fillers in the market, and you would probably be confused by the terminologies that your physician is using. There are some which help in lifting tissues. They are able to lift up the weight of the overlying tissues, and that's called the G prime value, or the ability to withstand a weight put on that filler. Once you inject a bolus, and then if that filler, especially the cheek, okay, if you want to give a lift and you want to lift up the tissues, then you want a product which has the maximum G prime. And in the market, Restylane Lift is the one which has the highest G prime of all the fillers, and I use this when I want to give maximum lift to achieve. There are others also from other companies like the Rejuvenation range and others which also have fairly high G prime, but the one with the maximum G prime at the moment in India is the Lift. And when you want to give a lift because they're sagging, then that helps the most. Other products are the ones which fill. They do give a little bit of lift, but they fill in the subcutaneous space, and you use those products when it comes to just filling a particular area, especially the middle cheek fat pads or the zygoma or the SOOF and the roof fat pads. But those fat pads, the ones that I mentioned last, they need to be filled in with a filler which is soft, a little smoother, and it doesn't give you a lumpy feel or a uneven surface. And that's why you want a filler that will spread evenly. So again, another filler is required. So your physician would probably be recommending different types of fillers for different areas, and the skill lies in assessing where to put which filler. Of course, then comes the actual act of putting the filler in, which is even more skillful, but you have to be able to take a right call on deciding on which filler to go where. So these are the various types, and usually these are kept ready in our clinic, and we do an assessment. We analyze using not only morphing software but a clinical analysis to decide the filler. The filler's longevity would also differ as per the type of filler. There are fillers which will last for a year. What happens at the end of the year? The filler will gradually hydrolyze and will be taken away by the body, and it shrinks. There are fillers which last for a year and a half. Anything more than that is of course desirable, but could lead to issues, because as the tissues change over the filler, the filler may start appearing more superficial and may give rise to some unpleasant appearances. So stick to those fillers which will last for a year to a year and a half. Go back and have a touch-up procedure. We do it as an outpatient, and barely minimal bruising is what you should expect, or hardly any bruising at all. You can inject it in two ways, either using a needle or a cannula. So again, where to use the needle and where to use the cannula would be for another talk. So I think for this educational video, I think this should be enough. So yeah, if you've liked the video, I would like you to share this video, and hope to see you for my next educational video. Thank you.